Hello my dear students, today we are going to study one of the cardiovascular system disorder, that is angina pectoris. So let us start with it. Before moving on to angina pectoris, let us understand the coronary arteries. Okay, so for you I am going to draw heart over here. Okay. So very important part is that from where does the coronary arteries arise? They arise from aorta. Okay, so if you know where is your aorta, you know this, right? You know this is the right atrium, this is the right ventricle, this is the left atrium, this is the left ventricle. From the left ventricle you can see the aorta arising, right? So from this, from here, there are the two branches which are coming out. Bear with my diagrams. Okay, so this is called as left coronary artery, which we call it as LCA. What we call it as LCA, that is left coronary artery, and this is called as RCA, that is right coronary artery. Okay, so from aorta there are two branches arising, which is going to, these two arteries are going to supply blood to the myocardium. So one is RCA and the next one is LCA, left coronary artery and right coronary artery. Now there are further branches of this LCA and RCA. Let us understand first the branches of LCA. So LCA, if you see here, it gives rise to further branches of LCA. One is that it gives rise to circumflex artery. This is called as circumflex artery. We also call it as CX. Okay, circumflex. Okay, it is circumflex artery. And then it is giving rise to, further it is giving rise to this artery. This is called as, a little bigger artery I have drawn, but this is called as LAD, that is left anterior descending artery. It's called as left anterior descending artery. So this is the main branch out of which these two arteries, like this is a main branch out of which these two arteries are coming. Okay, now let me talk about RCA. RCA further gives rise to, now this artery which is there, it is going back. This artery is going back. Okay, so since this artery is going back from behind, it is going behind, that's why it is called as PDA, that is posterior descending artery. It's called as posterior descending artery. Okay, and RCA is also giving rise to marginal artery, which is in the anterior region only. We are also calling as right marginal arteries. Okay, now left can also give rise to further branches of marginal. Marginal means what? Which are at the margin of the heart. So there is a left marginal artery also. There are various further branches, diagonal arteries also. So here what is more important for us is LCA, RCA, PDA, CX and LAD. Now why these arteries, coronary arteries are important? Because most commonly there is clot formation in this main arteries, and then it is going to cause further problem to the blood supply to the myocardium. That is, if there is any clot, for example, if there is any clot in this, let me take as LAD, what will happen? The blood supply distal to this region, because ideally this artery is going to supply blood to a myocardium. If this blood supply is affected, what will happen? What will happen? The blood supply to the downer region will be affected, and then it starts with pain first, and then further clinical manifestations are there of myocardial infarction. Okay, that we'll be studying further. Let us understand first what is angina pectoris. Okay, so this is mainly about heart. I have not drawn other structures. You have pulmonary arteries also. Okay, and your oh, so you can see a heart over here. So this is, instead of drawing, you can see now, if you can see, this is your superior vena cava, right? And this is your inferior vena cava. Remember, this always attached with your right atrium. Okay, I felt like I'd done a magic and brought a heart for you. And this is your aorta, and this is what I was talking from. Here is the division starting. You can see this. Okay, and this is your pulmonary veins. Okay, so let us move on. Different terminologies which you should understand before moving on to angina pectoris is arteriosclerosis. Arteriosclerosis means what? Hardening. Hardening of the arteries. Okay, when the arteries become hard enough, it is called as arteriosclerosis. What is atherosclerosis? This is a very important word which you are going to study in different cardiovascular diseases. That is atherosclerosis. What is atherosclerosis? It is nothing but build up of plaque. Okay, build up of plaque, that is nothing but atheroma on the lining of the arteries. That is, for example, this is the artery. Now I've little bit drawn a bigger artery for you to understand. Ideally our coronary arteries are very small. Now what happens in the artery, there is collection of fat deposition, we can say. This fat deposition, that is nothing but when you eat more amount of fatty foodstuffs. When anyone eats more amount of fatty foodstuff, there are chances of collection of fat. Okay, so this is called as a plaque. Okay, now this, if increases, can block the arteries. Okay, so this is called as atheroma. Okay, or plaque. You should know this, plaque. Next is, so arteriosclerosis and atherosclerosis, hope so you have understood. Next, end result of both are the same. What you mean by this is, both can result into what that we are going to see. Okay, either it is hardening, your arteries have become hard enough. Okay, what this is going to result and what this plaque is going to result, we see that. First is stenosis. Stenosis means what? Closure. Now stenosis is like, for example, as I said, this is increasing. What will happen? It will block the lumen of the artery. It will block this, right? The blood is not able to pass. Yes or no? Next is ulceration. What do you mean by ulceration? Now this plaque which is there, okay, it will ulcer, like we have ulcers, na? So it will start, when it ulcers, what will happen is, it will come in contact, it's always coming in contact with the blood, and when it ulcers and it coming in contact with the blood, ulcers, because almost ulceration comes out and it comes in contact with the blood and it further forms thrombus. Okay, this ulceration and then further rupture, this plaque will rupture, and when it comes in contact with the blood, it will form a clot. Okay, ulceration of plaque, rupture of plaque can further lead into thrombus formation, because blood is coming in contact and blood can come on it, and that is most commonly the platelet goes and aggregates on the particular plaque and then forms a clot. Okay, this will further obstruct the blood flow. Why? Because as the blood is passing, if this is, now this is there, it is not totally closing the lumen of the artery, but if it increases in size, what will happen is totally going to stop the blood flow to the myocardium, right? And what will happen is ischemia, that is lack of blood supply to the region distal to the thrombus. Distal means niche to the thrombus, not upper part will not get affected, because the clot is, where the clot is there below the region will be not getting the blood supply. Understood? This is about main terminologies which are there when we are studying about angina pectoris. So let us start with angina pectoris. Very important, commonly asked in your exam, like what is the definition of angina pectoris, what are the types of angina pectoris, what is the management? Commonly asked question. Okay, so let us start with the definition. Angina pectoris is a clinical syndrome. Why it is called as a clinical syndrome? Because there are many clinical manifestations seen that we'll be seeing further, characterized by, or what is the main characteristic of this angina pectoris? Episodes or paroxysms of, what do you mean by, you also called as paroxysms or paroxysms, okay, paroxysmal. Okay, now what is paroxysms and paroxysmal? It is nothing but sudden onset. Okay, sudden onset of pain. Suddenly the person has a pain. You must have seen in movies, suddenly a person has a chest pain, right? That's nothing but angina. Angina pectoris. Of pain or pressure in the anterior chest. It is a chest pain resulting from inadequate blood supply to the myocardium or myocardial ischemia. Very nicely the definition says that why the person is having pain, because there is lack of blood supply to the myocardium. And why there is a lack of blood supply? Because the coronary arteries are been occluded. Okay, the coronary artery can be occluded with the plaque or with any clot. Understood? But what you are going to write in definition of angina pectoris is the clinical syndrome which is characterized by episode or paroxysms of pain or pressure where in the anterior chest. And why it is happening? Because it is the chest pain resulting from inadequate blood supply. The myocardium is not getting adequate blood supply, and that's why. Clear enough? The insufficient coronary blood flow results in decreased oxygen supply to meet an increased myocardial oxygen demand in response to physical exertion or emotion. So when you are writing definition, this is enough. But just a further point which is described, coronary blood flow is not, means the coronary blood flow is insufficient. For what? Myocardial demand is increasing, but supply is decreasing. That is because of that clot, the blood is not flowing to the myocardium. Maybe the person must have exercised. You know, you must have seen, again I can say in the movies, a person is on a treadmill, he is exercising and suddenly he develops a pain. Why? Because the myocardial demand has increased. For example, if you just you're not catching a lift and you are walking from the first staircase or from the ground floor to the 5th floor, just imagine what will happen. Your heart start beating fast because it has to cope up with the requirement of the body, right? So the same thing happens during exercise also. So when the body's demand increases, myocardium works more harder, and at that moment the supply is less, okay, and demand is more. Commonly during exertion or any emotional stress, you must have seen people when they are very happy, they get an attack, right? Yeah, too much. It's not every time, okay, it's like too much happiness, too much sad, that can lead into an attack for a person. Are you understanding? Okay, so this is what it is written over here. Hopes you understood the definition. Let us move on to the main etiology. Angina pectoris is associated with atherosclerotic lesion and is a manifestation of coronary heart disease. You can understand it is a manifestation, that's a clinical manifestation of coronary artery disease, which we will be studying further. Okay, coronary artery disease, okay, which is nothing but a disease of arteries. Coronary arteries are nothing but the arteries which give blood supply to the heart. Okay, we have just started studying about it. What is atherosclerosis? It's one of the factors which is causing coronary artery disease. Okay, it can be caused, how this is caused? Angina, chronic or acute blockage. Now what is chronic and acute blockage we'll see further. And what is coronary artery spasm? You can see this is called as a spasm. Your arteries are going in spasm, commonly seen during winters, you know, when there is too much cold. Ideally when our body comes in contact with a cold environment, there is vasoconstriction, right? The same thing during winter season, or when a person, sometimes the person is sleeping in an AC room, and that too with a very low temperature, there are chances that the artery can go in spasm. Okay, so chances are not every time. So because of this spasm, what happens is that the blood supply is reduced to the distal region. Okay, and then it can cause the person developing pain. Are you understanding? Yes, but most common cause is this chronic or acute blockage, okay, of the coronary artery. Okay, let us understand this chronic and acute blockage. Chronic blockage are associated with the fixed calcified type VB or fibrotic type VC atherosclerotic lesion that occlude more than 75% of the vessel lumen. Now, what do you mean by chronic blockage? Now, ideally, now this what is calcified and fibrotic atherosclerotic lesion we'll be studying in detail in coronary artery disease, but in simple term I will explain you what is happening. Okay, now this is a coronary artery. A person who is, let me take it, around 25 years of age, and he is still having a sedentary lifestyle. He is eating lot of fast foods with many cheese or cheeseburger. Hope so you are not feeling hungry listening to this. So he is having more amount of fatty food stuff. At that time he will start developing small plug region. Okay, now I can stay very small. Okay, now this is going to slowly increase with time. Okay, now let me take it 35 years, just an example. 35 years it must have increased to this much extent. Okay, so this is what chronic blockages are, nothing but which are slowly increasing with time, and as it is increasing it will totally block the, I'm not drawing some diagrams over, I'm not drawing some rainbow over here, but I just want to make you understand that this is what is happening. As that blockage is increasing, as that plug, okay, plug is increasing, the blockage will increase, and then the blood supply is totally obstructed. So here you will see no blood supply. Are you understanding? That is called as a chronic blockage. Now chronic blockages are mostly because of fibrotic or calcified type. We'll be studying further in that. Next, acute blockages are more common. Now what happens in acute blockage? You can see coronary artery results from rupture or disruption of vulnerable atherosclerotic plaque that cause platelet aggregation and thrombus formation. Now what is happening over here, you know, that this particular plug, now let me take this as a plug. What is happening? There is rupture. Okay, it will rupture or ulcerate, then it comes in contact with the blood. Now when it is coming in contact with blood, what will happen is it will try to form a clot. We call it as thrombus formation happens, or clot formation happens, and this clot will further block the lumen. Now this is partially blocking. If I make it little big enough, it will be complete blockage. Understood? So acute blockage will be because of the rupture of the plaque and when it is coming in contact with the blood. So let us understand what are the factors that can precipitate this angina. Okay, when fixed blockage are present in the coronary arteries, condition that increase. Let us understand what are fixed blockages. I told you just now, this is a blockage which is mostly in a chronic type 1, right? Chronic type 1 is where the plaque is further increasing slowly. It takes time. Sometimes at the 25 years of age, a small plaque starts developing. It will take it to totally block the coronary arteries more than 10 years. Yes, sometimes 15 years also, more than that. So it is like slowly. You see, I feel this is a very good mechanism which is there. It's not good as such, but our body is telling us that you try to improve yourself, right, to have a healthy lifestyle. Just going apart from the topic, but I feel that we should adopt healthy practices so that we don't develop such diseases. So let us understand what are fixed. As I said you, chronic blockages are the fixed blockages which slowly increase. So what can precipitate such type of blockage to cause angina in a patient? Okay, condition that increase myocardial oxygen demand and precipitate episodes of angina are, first is common physical exertion. Okay, physical exertion means what? When a person is doing an exercise. I gave you an example. Once you walk, right, once you walk from ground floor to 5th floor, your body's demand is increasing, oxygen demand is going to increase, so your heart will beat faster. Okay, now if there is a fixed blockage like this, okay, now heart is beating faster, the vessels, okay, the vessels will little bit constrict, okay, What will happen because of this? Sometimes it constricts, sometimes because it has to meet up the demand, this blockage will obstruct the blood supply. When the blood supply is obstructed, the person suddenly develops pain. Okay, so that is mainly, most commonly, because what happens, the demand of the body is increasing but is not able to supply it. Okay, oxygen supply is not reaching to your myocardium. We are talking about myocardium, remember this, because coronary arteries are supplying blood to the heart muscle. Okay, next is, this is common because in cold, this is what I was talking about, vasoconstriction. The vessels which are like this will become like this, and then when this clot, it's going to completely block it. Okay, vasoconstriction of the vessels commonly seen in cold weathers. Okay, and elevated blood pressure with increased oxygen demand. The demand is increasing of the myocardium, but it is not able to supply. Okay, next is eating a heavy meal. Too much the person has ate. Okay, बहुत खा लिया. Okay, increase blood flow to the mesenteric area. So there will be increase in blood supply to your mesenteric area for digestion. Okay, gastrointestinal, especially your digestion, the blood supply, for digestion, the blood supply is increased. So what will happen? There will be reduction of blood supply to the heart muscle. So a person can develop, sometimes it happens, a person takes a very heavy meal and suddenly he develops an heart attack. Okay, I've also seen that person who is going to washroom and he is trying to put too much pressure if he is constipated. That time also, because you are exerting pressure or you are struggling for it, that time also, because demand is increasing, right? You are taking effort. That can also lead to heart attack in few persons. There are many cases which I've heard about. Next is stress. Common nowadays. People suddenly, when they know that they have got, I have seen one case where suddenly the person knew that he got a, 10 crore lottery he has won. Because of that happiness, he got an heart attack. Right? That's a stress or emotional a reaction to different parameter. Either it is happiness or sadness, or when you get shocked hearing some news, you get a heart attack. Means the person gets a heart attack, right? Causes a release of adrenaline and increases the myocardial workload. Okay, when myocardial workload is further increased, like in exercise, the same thing over here also, when workload is increasing, okay, then there will be less blood supply available to supply to the main myocardial area where there is this presence of fixed blockage, like in physical exertion, as we have seen. Okay, so how can you remember these factors to precipitate typical angina? So you can remember ease. Okay, first is exertion. Okay, then is extreme temperature, eating heavy meal, and emotional distress. Or emotional distress means any emotional status where the person is getting disturbed. So there are 4 E's which you can remember. Okay. Next, very important question, commonly asked in your vivas also and in your exams also. What are the types, patterns or classification of angina pectoris? Commonly asked, so you should know this. So first one is stable angina, which is called as a classic angina. The word only suggests stable. Stable means there is no, there's no change. It's stable enough. Okay, there's no change happening. Okay, so here what is stable? It is a paroxysmal chest pain or discomfort triggered by predictable degree of exertion or emotion. The word, first let us understand what is predictable. I can predict. Okay, I can predict that if this person is walking for at least 15 minutes, then he can develop, and that too around this much, almost he's walking from his home to this particular shop, he can develop chest pain. That is called as predictable. I can predict this. If this particular stress happens, then he can develop. So this is predictable. I can predict that because of this thing, if I tell him to do treadmill for 15 minutes, he can develop. That is called as predictable. Okay, I can predict that you all will get very good marks in your all papers. So I'm predicting this. Right? So it's the same thing here. I can predict that this can happen to the person. Okay, and it is always, this is very important, this is triggered by predictable degree. So I can say this will happen only because of this, or the pain will develop because of this particular thing only. Okay, so this is common in a stable angina. Next is characteristically a stable pattern of onset, duration, severity and relieving factor is present. What do you mean by this is, how is the pain starting will be same always. The person is getting up and doing a treadmill for 15 minutes, again he develops. That is the exact time period he develops a pain. Okay, that is onset of the pain. Duration, that is 15 minutes. चालू कब हुआ? 15 minutes के बाद हुआ, 15 minutes किया. And severity, how is this pain severe enough? He may say it's like a squeezing pain or it is just a discomfort. Okay. Next is relieving factor. This is very, very important related to stable angina. Okay, stable angina is, this is very important, should never forget. Relieved with rest or nitroglycerin or both. What do you mean by this is, the stable angina is relieved. Relieved means the pain is reduced when I make the person, you just sit down, or I give a nitroglycerin tablet to him. Now nitroglycerin tablets are vasodilators. As you know what is happening, mostly because of the constriction or increasing workload, even sometimes the vessels become small enough. So because of this, there is lack of blood supply to your myocardium. This is the main medicine given from many long time, vasodilator. I will dilate the vessel so that there is adequate blood supply to the myocardium. Okay, so when I'm giving this nitroglycerin tablet or when I'm telling you to rest, the pain is relieved. There's no pain for the patient. This is the characteristics of a stable angina, very important. Okay, so what you need to remember in stable angina, that there is a predictable degree of exertion or stress, and it is relieved by rest, or sometimes both also. You give rest or you give nitroglycerin or both, the pain is relieved. Okay. Now next is very important, unstable. का मतलब क्या है? It is not at all stable enough. And here if I compare with a stable angina, it is not at all predictable. I don't know when he will go in an unstable angina. Okay. It is also called as pre-infarction. What do you mean by infarction? Myocardial infarction, that is heart attack. Before getting an heart attack, the person develops pain. Before getting heart attack, the person develops pain, and that is showing that he is going to get an myocardial infarction. That is called as pre-infarction angina. It is paroxysmal chest pain or discomfort triggered by, and this is very important word, unpredictable. I can't predict कि उसको कब pain आ जाए. Unpredictable degree of exertion or emotion. Characteristically an unstable pattern. So there was a stable pattern. Here what you are going to write, unstable pattern. I don't know when it's going to start. I don't know what will be the duration. I don't know what will be the severity, and even I don't know. I don't know these three things about the person. And this is also very important, not relieved. उसको मैं rest करा रही हूँ. I'm telling him to sit down. No relief of pain. I am giving nitroglycerin tablet to the person. Ideally, we give a sublingual tablet to the person. Sublingual means where you're going to keep under your tongue. So one tablet I give him and I wait for 5 minutes. Even if the pain is not relieved, the second tablet I give in 5 minutes. And the next tablet, even if the pain is not relieved, I give the third tablet sublingually, 3. Okay, 15 minutes total. So 3 tablets are given at a 5 minutes interval and we are giving it. Then also the pain is not relieved. That means it is an unstable angina, which is an emergency. You have to rush the patient to the hospital. Okay. So if an unstable angina occurs, it must be treated as a medical emergency. You have to take the person to the hospital because he is going into MI, myocardial infarction. Are you understanding? So unstable angina is a medical emergency. It is not relieved. Pain कम नहीं होता. It is not relieved by rest or nitroglycerin tablets or both. दोनों करने से पेन नहीं रिलीव हो रहा है. And we don't know how much a person walks and he can develop. I can tell you, I'm talking about little of my MI where I've seen a patient. He was just I've heard about it from my friend. He was in the ICU, he was just lying down, and he just requested my friend to lift the head up or make the head up. So she was just trying to do it, and as she was lifting or trying to, with the help of our bed, we never had these buttons or the advanced bed. We should just press a button. No, it was with the help of we had a lever like thing where you used to roll it up, and then the bed used to come up. So she just tried to do it, and suddenly he developed pain. That is what, this is unpredictable. You don't know when the person will develop pain. That small effort by the heart was not able to cope up. That was the level of blockage in his heart, in his coronary arteries especially. Are you understanding? So unstable angina, hope so it's clear. And never forget to write these two main types. Even if you forget to write other types, stable and unstable, you should never forget. I'd always mention it, the first two, because that is the most common types which we are seeing in patients also. Okay, stable and unstable. Okay, next is a variant angina, or is also called as Prince metal angina. It is chest discomfort similar to classic angina but of longer duration. It may occur while the client is at rest. Now this results from coronary artery spasm. This attack tends to happen between midnight and 8 a.m. You must have heard about it. Many people die in sleep, mostly because of MI, mostly because of myocardial infarction. Commonly it is seen. Now here, this is mainly because of coronary artery spasm. Just remember, during winter seasons when the temperature is too cold, or a person is lying down in an area where the AC temperature is very low. Okay, so if the person has a fixed blockage and suddenly the vessels go in a spasm, that can lead into what? This variant angina. Okay, and that's why it's commonly seen during night time. The person getting an attack, and where you don't understand because everybody is sleeping, okay, and suddenly he develops an attack, and sometimes he can die also, right? Next is nocturnal angina. Nocturnal means during night time, that is, it's associated with REM movement, sleep, during dreaming. Sometimes during dreams you must have seen many not so good dreams, or something very much dangerous dreams you must have seen, and suddenly you get up, right? It must have happened to you, right? So such types of angina which develops when the person is dreaming something, and as you know, when you are dreaming, we call it as rapid eye movement. Non-rapid eye movement, rapid eye movement. Okay, sleep cycle, this is all. So rapid eye movement, it is mainly during dreaming. When we dream something, what happens is that suddenly we see something very much shocking or very much dangerous, we get up, right? So that time when some person has seen something during dreaming, he will get a sudden chest pain. Okay, and if the treatment is not given, he can also die because of MI, right? So angina decubitus, it is a paroxysmal chest pain that occurs when the client reclines or lessens, when the client sits or stands. Now just I gave you an example, she just lifted the bed or did a head up for the person, and suddenly he develops a pain. That is called when the person is changing the position, sitting or sleeping or standing. Mostly sitting and standing, the person may develop chest pain. That is called as angina decubitus. Next is intractable. It is a chronic incapacitating, that is unresponsive to treatment. Intractable, we are not able to understand what is the reason behind that pain. That is called as intractable angina. So chronic incapacitating, that is unresponsive, not responding to the treatment. Very rarely to see. Next is post-infarction angina, that is after a person has developed an heart attack, again the pain can develop if the treatment is not given properly, or there are chances of again coming through some stress or something, he can develop post-infarction angina. Pain occurs after MI when residue ischemia may cause episode of angina. Okay, these are the most common types, patterns or classification of angina, but never forget to write it down: stable and unstable angina. Next is the pathophysiology. Before understanding the whole pathophysiology of angina, let us understand what are the factors which affect, okay, the oxygen demand and supply of myocardium. Okay, so factors influencing myocardial supply and demand. What do you mean by supply? Means where the oxygen, that is the blood supply, which is also with the oxygen to the myocardium, is decreased, and when the demand is increasing. We have seen few of the demand increasing during our precipitating factors. So let us understand first what are the factors that decrease the supply of, that is, blood supply to the myocardium. The first one is coronary vessel disorder. When your coronary arteries are affected, common, this is the commonest thing, atherosclerosis. As I said, your arteries having plaque formation, arterial spasm. Okay, it is leading into a vasoconstriction state, or it is decreasing in size, spasm, it's going in spasm. Okay, so blood supply totally, it will go like this. Okay, spasm. These are two reasons where coronary artery problem is there. Next is circulation disorder, hypotension. What do you mean by this? Is there is less blood supply in our body. When there is a less amount of blood supply going on, what will happen? Your myocardium is not going to get it. Aortic stenosis. What do you mean by aortic stenosis? Let me draw a heart for you. So this is your aorta and this is your valve of the aorta. Now, if this is blocked, now it can't be totally blocked. Totally blocked means what? You have to do emergent surgery, because the blood from the left ventricle will not pass to the whole part of the body through aorta. Stenosis, when this is a or not total closure but partial, if there is closure in the valve, what will happen? There is less amount of blood supply. Okay, so less amount of blood supply will also reach your myocardium. What do you mean by aortic insufficiency? That is regurgitation. Regurgitation means what? Your this valve, aortic valve, is not functioning properly, and instead of, ideally valve has a function of letting blood flow in only one direction, but here instead of it going in this direction, because it is not functioning properly, the blood is coming back into the left ventricle. The blood is coming backflow. We say it as backflow of blood. Now, because of backflow of blood, what will happen? There won't be adequate blood supply to the whole part of the body and our myocardium also. As we have seen, the two branches are starting from the aorta itself, right? You have seen this. Next is blood disorders. What is anemia? Anemia is nothing but less amount of red blood cells, so less amount of oxygen supply, right? Oxygen supply to the whole part. Mostly we say less amount of hemoglobin in our body, right? And when there's less amount of hemoglobin, there's less amount of oxygen supply to the part of the body. So again, our myocardium is not going to get it. Hypoxemia. There are different conditions which can lead into hypoxemia. That is again less amount of oxygen in the blood. Okay, so if there's a less amount of oxygen in the blood, our myocardium is also not going to get it. Next is polycythemia. Polycythemia is increased red blood cells in our blood, and when there are more amount of red blood cells, what will happen is that there can be clot formation, increase in clot formation, and as it's increases, the concentration, or we say hemo concentration, increases, and because of that there can be clot formation. Next is factors that increase demand. Now, why we are studying this? You need to write it down. What are the different factors which are going to increase the supply, myocardial supply and myocardial demand? Demand, what are the different conditions which can increase our heart demand? First is, this we have already seen in the precipitating factor, exercise. When the person does an exercise, heart's demand increases. Emotion, as I said you, when the person is very happy, right? For example, you must have felt like if somebody says you that you have won a 1 crore lottery or 10 crore lottery, you feel happy, right? And that happiness, as we have seen, that adrenaline releases, our heart beats faster, right? And then that time oxygen demand is increasing, but it is not able to supply. Okay, so demand is increasing. As I said, digestion of large meal, बहुत खाना खा लिया, too much food the person has eaten, so the blood supply is increased in your mesenteric region, that is for digestion, is not reaching your heart. Okay, less is reaching your heart. Anemia, we have already seen. Hyperthyroidism, what happens in hyperthyroidism? Increased amount of thyroid gland is releasing more amount of thyroid hormones. Okay, now because of this, what is happening? Increasing demand. Okay, there is high metabolic rate. To maintain this high metabolic rate, the heart has to beat faster. Most commonly, hyperthyroidism patient has tachycardia. The heartbeat is always more than 100 beats per minute, so it has to cope up with this. So in hyperthyroidism, people do have increased demand because heart is beating faster. Okay, there are few more factors that can increase the demand. The second one is increased myocardial need for oxygen. Damaged myocardium. Okay, the myocardial muscles are damaged. Okay, so again we have to provide more oxygen to the myocardium, so it has to function properly. Next is myocardial hypertrophy. What is hypertrophy? We will be studying cardiomyopathies where the muscle increases in size. When muscle is increasing, more blood supply has to be provided, right? More supply has to be provided. Oxygen demand is increasing of the muscles. Aortic stenosis we have seen. Aortic insufficiency is nothing but aortic regurgitation, the valve regurgitation. Strong emotion, as I said, is not just sadness, or it can be happiness also. Extreme happiness, extreme sadness or shocking news can cause pain, sudden pain. Thyrotoxicosis is nothing but a complication of hyperthyroidism. Now I just told you about hyperthyroidism. Just understand, when a complication, that is again increased amount of increased amount of metabolic rate is increased, the heart is going to beat more faster, so oxygen demand is again increasing. And heavy exertion means too much exercise a person is doing, then again myocardial demand is increasing, but our coronary arteries are not able to supply it. Are you understanding? So these are the few factors which I have discussed. Now you don't have to mention everything, but at least mention what are the factors which can increase the demand and what are the factors which decrease the myocardial blood supply. Okay. Let us understand the pathophysiology. First is altered myocardial supply and demand. That's why we discuss what are the factors which can alter the supply and demand. Okay, so you can just one word we are writing. Either it is some problem in the supply or there are some problem in the demand. Okay, that will lead to myocardial ischemia. What do you mean by ischemia? That is, there is lack of blood supply to the myocardium. Okay, myocardial cells are not getting adequate blood supply. Because of this, the pumping function of the heart is reduced. The heart is not able to pump properly. Because of this, ischemic cells are deprived. Ischemic cells are, that is, the myocardial cells are not getting adequate oxygen. Okay, because of this, the cell is getting converted into anaerobic metabolism. Ideally, the cells are undergoing aerobic metabolism, that is with the help of oxygen. But because of anaerobic metabolism, lactic acid, this is the main, the main problem why the person develops pain is because of lactic acid accumulation. Anaerobic metabolism leads into lactic acid accumulation, and then only the person develops pain, that is angina. Are you understanding what is happening over here? The culprit, I can say, okay, the main problem over here is because the cells are not getting oxygen, and you know why it is not getting oxygen. So because it is not getting oxygen, what is happening is there is anaerobic metabolism, lactic acid is accumulated, and because of this lactic acid, the person is developing pain. This is the pathophysiology of angina pectoris. Hope so you understood this. Also, you should never forget about this main thing, that is anaerobic metabolism, lactic acid production. Okay. Next is the clinical manifestation. Yes, this is also very important. You should know what is the clinical manifestation of a typical angina. Okay. So, how is the onset? Now, we can also say it as characteristics of angina. How is the onset? कैसे start होता है? Either most common, it is quickly, suddenly the person has pain. Okay, so quickly, or sometimes it can be slowly also, but most commonly it is quick. Location, कहाँ दर्द होता है? Where is the exact? Retro, that is below the sternum. Sternum bone, you know, below the sternum the person has pain. Okay, retrosternal, or slightly to the left. Okay, because our heart is at the left side, so slight left to the sternum the person starts having pain. Now here very important is that you should able to identify the pain of due to some gastric problem and a pain which is related to our this angina, which is going to lead into a heart attack or myocardial infarction. Okay, so these are typical signs and symptoms which are related to chest pain related to myocardial infarction. A pain of gastric is sometimes like burning sensation over here, epigastric region. Okay, so that is different. But you should ask the person where is the pain, or you should tell them where it is radiating, which we will be seeing now. Okay, radiation, very important. This is only related to angina and MI, myocardial infarction. Okay, the pain radiates to the left shoulder and upper arm. So where it radiates, मतलब फैलता कहाँ है? So it radiates to the left shoulder. Okay, okay, and then to the upper arm of the left only, left upper arm it will radiate. Then travels down to the inner. What is the inner aspect? This is your inner aspects. So it travels down to the inner aspects and reaches to your last two fingers. This is a very important clinical manifestation of angina. So this you should remember. So where it radiates to the left shoulder, left upper arm, inner. This is called as the inner aspects, and can reach to your last fingers, that is fourth or fifth finger. This is an important clinical manifestation. So to the left arm, to the elbow. So this is reaching in the inner aspects, elbow, wrist, and your last two fingers, that is fourth and fifth finger. Pain may also radiate to the right shoulder, neck, jaw, or epigastric region. But this is the typical pattern. Some may have radiation to the jaw. Yes, jaw radiation. Till here the person will feel like a pain. Sometimes it is to the right, very rare, but it can have, okay, right shoulder. But this jaw and this side is most common. Okay, and that is what jaw and the neck. This is common. Neck and jaw is most common. Epigastric, sometimes a person can have, but typical characteristics is this. Hope so it's clear. Do mention about radiation in the clinical manifestation. So we have seen onset, exact location, and radiation of pain. Next is duration. Kitna der tak, till what time period? Angina usually lasts for 5 minutes. However, attack precipitated by heavy meal or extreme anger, बहुत ज़्यादा गुस्सा, right? Extreme anger and heavy meal can precipitate the pain for almost 15 to 20 minutes. So it's better not to have too much heavy meals. Take very less, or जितना खाना चाहिए उतना ही limit. There has to be limit to everything, right? And too much anger, why we have to get angry? Not at all, right? So this can lead into 15 to 20 minutes. Otherwise, it only lasts for almost 5 minutes. So when this person starts having pain, if you give a nitroglycerin tablet, if the pain is reduced, good, that is a stable one. The pain is not reduced by giving 3 tablets of nitroglycerin, then you have to take it as an emergency, shift him to the hospital. Okay. How is the sensation? Sensation is how the person feels like the pain is. Okay. Squeezing. What is squeezing? Someone who is squeezing them. Yes, we squeeze someone, like squeezing pain it is. Burning, jalne wala. Now, this is one important thing. If anyone is telling you, I'm having burning sensation, then ask them where exact is the pain radiating somewhere, because radiation pain is typical related to our angina. Radiation, okay? Burning, pressing, someone is pressing them tightly, choking. Okay, feeling like someone has, you are just going to lose your life, you feel a choking type of pain. Someone holds the neck, how you feel? Choking type of pain it is. Aching, pain, okay, bursting. My chest is going to burst out, that much pain. Okay, these are the different words which the patient have said, and that is mentioned as sensations. Okay, these are the different sensation which the people say. Okay, how is the severity? Usually it is said that the person say mild or moderate. This is the only problem, you know, because a sensation of burning, they feel like it is just a GI problem, but it's very important. You need to see the age of the person. Any history of any hypertension or something which is related to heart, just go and do an ECG, which is good enough to know that whether the person is going to go into an MI or not. Okay, so mild, because the pain sometimes goes in a mild or moderate level. They never say it's a very severe pain. Okay, moderate pain with such sensation they are having. Okay, so it's often called discomfort, and sometimes they never also say pain. So discomfort which they feel, there's something which is disturbing, but not exactly as a pain. Okay, few more characteristics, associated characteristics. Along with that, what all thing the person may feel. Sometimes they may have difficulty in breathing, pallor, sweating, they start sweating a lot, faintness, goes chakarana, palpitation means what? You can feel your own heartbeats. For example, if you are walking from ground floor to the fourth floor, you can feel your heart beating fast, you can feel it. That is called as palpitation. Dizziness, digestive disturbance, you feel something related, like again you can say difficulty in breathing, along with that you have burning sensation. So that is digestive disturbance which you are going to have, not difficulty in breathing, digestive disturbance. He may feel that I am having burning sensation and all. Atypical presentations are typical for the patient. Atypical means which is not related to our chest, but diabetic patients, okay, we will be seeing about the women, older adults, and client with diabetes may have atypical, which is not as a typical signs and symptoms of our chest pain, can have, and we have to be careful when we are handling this such patients. When they say back pain, epigastric pain, fatigue and syncope, again the person feeling like faintness, okay, you feel unconsciousness. Syncope is you feel unconscious for a few minutes. Okay, so if such things is there, you should never neglect it, because this can be that the person is developing angina. Who? Women, older adults and client. Nowadays every fourth or fifth person in India are suffering with diabetes. Yes or no? So such patient needs to be carefully handled. When they are complaining of back pain also, you can see that back pain also we should be very careful of. Okay, this is relieving and aggravating factor. Relieving means क्या कम करेगा पेन, aggravate क्या बढ़ाएगा, what is going to increase, what is going to decrease the pain. So angina is aggravated, increased by continued activity. Person is continuously walking, doing exercises, that can increase the pain, and quickly subside. Quickly means fast, it is going to decrease by nitroglycerin and rest. When the person is taking the nitroglycerin tablet sublingually, the pain is going to reduce, but be very careful. 3 tablets given 5 minutes apart, pain is not relieving even with this tablet and the rest. It's a medical emergency. You have to take the patient to the hospital. Remember that. Okay. So this is about the characteristics of angina. We can also say clinical manifestation. Ideally, angina is a clinical manifestation of coronary artery disease. Next is the assessment and the diagnostic finding. How can you diagnose this patient? Okay, the first thing is ECG. So 12 lead ECG, that is nothing but electrocardiogram, where we have to see for specific signs and symptoms which we can see nicely in ECG. Commonly is ST segment elevation. Okay, ST segment elevation or depression can tell us that the person is leading into MI. Now, what is this ST segment? If you know, or we will be studying further, this is P, this is Q, this is R, this is S, and this is T. So this is a normal ECG, and we are talking about this ST. ST segment, okay, segment is something which is joining 2 waves. Okay, now this is P wave, QRS complex, and T wave. So this is called as a segment. So this is ST segment. Ideally, ST segment is isoelectric. That is, it is not going up down. It's always neutral. Okay. Now, in a patient who is going into an MI or almost had, we can have such elevation. Elevation means upar jana. Depression means it will go down. Okay. So this is called as ST segment elevation or depression. Next is a stress test. What is a stress test? Where we make the person to walk on a it's like a treadmill. We'll make the person walk, and slowly we increase the speed in order to understand how much is the tolerability of the person to the stress given. Like ideally we are increasing the rate on the treadmill so that we can understand how is the heart coping up with the stress given to the person. Okay, now here we are, when this has been done, his heart rate, his blood pressure are continuously monitored, and in between we also ask him whether you are having any pain, because that will show us that the person is going into angina or not. Okay, next is coronary angiography. What is coronary angiography? We'll be studying this in detail, but in short let me tell you what is angiography. Here we try to put a dye inside our blood vessels and try to see where is the exact blockage. Okay, exact blockage in the coronary artery. Okay, if while doing this, when the dye is inserted, we try to take pictures. Okay, and pictures means what? X-rays are continuously taken in order to understand where is the blockage. If there is a blockage, then the person undergoes angioplasty. Okay, coronary angioplasty has been done for him. Next is X-rays. What chest X-ray is going to tell us? Detection of cardiomegaly. What do you mean cardiomegaly? Is that heart has increased in size. We call it as cardiomegaly. We have seen one factor like myocardial hypertrophy. So that can be also understood in a chest X-ray when it's increasing in size. And non-cardiac causes of chest pain. Now, as you know, if a person says a chest pain, is not always that it can be related to heart. It can be because we have lungs also, right? So in order to understand if there are some other causes of this chest pain, we can do a chest X-ray and find out the other causes. Okay, fasting glucose and lipid profile, very important. Why? Because we have seen a diabetic patient giving some atypical presentation. So for that, and lipid profile, we should know how much is the cholesterol, triglyceride. If that is increased in the person, then sure he may have atherosclerosis, plaque formation. Okay, for that we have to check the lipid profile. Why hemoglobin level? Because we have seen anemia plays a very important role in decreasing the oxygen supply to the whole part of the body and then to the myocardium. Okay, so these are the assessment diagnostic finding. Next is the medical management. What is the main objective of the medical management? To relieve. The first thing, we have to relieve the pain which the person is suffering. Next is restore back the coronary blood flow, because the blood flow is not restoring or because of the clot. Prevent further attack to reduce the rise of AMI, acute myocardial infarction. AMI is acute myocardial infarction. Most commonly we use this medical management, we say that MONA. Okay, we say it as MONA. MONA means what? M for morphine. Morphine is an opioid analgesic commonly given. Next is O for oxygen. N is nitrate, which is a vasodilator, so that when the vessels are dilated, restoring coronary blood flow. A is aspirin. Okay, so these are the most common thing, which is common treatment which is given for angina. Medical management consists of pharmacological therapy. This is one. Oxygen therapy. We also call it as PCI, that is percutaneous coronary intervention. Now, what all thing comes under this is angio, as I said, coronary angiography is done. So that can come. Angioplasty, we will repair it. Okay, now there are different, previously it was a balloon angioplasty. Now what we are doing is a stent. We are putting a stent where there is a blockage. Okay, so stent is commonly put nowadays. Then coronary artery bypass grafting, CABG surgery. This is a surgery which will be done if PCA is not possible for the person, or the percentage of blockage in this arteries are more, then we don't go for this PCI, or we don't go for angioplasty. We directly move on to coronary artery bypass grafting or graft. What you mean by this is, we try to use some different graft. Now what is a graft? You know, we will be using a artery or we will be using a vein. where we are going to attach this artery and vein. Yes, we are going to remove this arteries and vein and attach it to the region distal to the blockage. Distal matlab to the down region. Just an example for you. This is my aorta. So this is the artery. Now let me take it that RCA is blocked. Okay, RCA. This is RCA, right coronary artery. This is blocked now, and this is the thrombus over here. I will be attaching. Now let me take it. Most commonly saphenous vein is used and mammary arteries are used. So I will take one. I've taken vein now. So I will attach the vein over here and attach the other part of the vein to the aorta. Okay. So I will bypass. I'm doing what? Bypassing. You have a bypass road. The same thing over here. Bypassing means what I'm doing is I am attaching one end of the vein to the aorta, and then I am attaching the other end of the vein, other part of the vein to the distal end. Means जहाँ पे block है उसके नीचे I will put down to that blockage so that the blood supply is maintained. Now what is happening is through aorta directly that particular graft is going to give supply to the downer part of the myocardium, where here even if the blood is passing, because of that clot we are not able to give blood supply. That's why we are using a graft, that is coronary artery bypass graft. So graft what we can use is artery or vein. Okay, so this is the medical management. We'll study about pharmacological therapy and oxygen therapy. What is the goal of the pharmacological therapy? To increase oxygen supply to the myocardium and reduce myocardial oxygen demand. So most common, this is commonly used, nitrates, nitroglycerin. Okay, so what it is a vasodilator. It will dilate the vessel. So dilation of vessel will nicely allow the blood to flow into your myocardium. Helps reduce pain and prevent further attack by widening the diameter of coronary arteries and increasing supply of oxygen to the myocardium. Administer how it is given? Commonly it is given sublingually. Sprays are also available. Per oral also it can be given, and intravenous also. Side effects: hypotension, flushing and tachycardia. Okay, so these are the side effects of nitrates. Next is the beta blocker. Reduce myocardial oxygen consumption. Beta blockers are always ending with lol. Lol, you know, na? So all beta blockers will end with lol. That is metoprolol, propanolol, atenolol. These are all lols. All lols are beta blockers. So reduces myocardial oxygen consumption by decreasing heart rate, contractility and blood pressure. Beta blockers are also commonly used for hypertension patients. Okay. Caution client not. This is a very important thing which we need to tell a patient taking a beta blocker. Okay, not to stop abruptly. बीच में कभी भी बंद नहीं करना है. You should never stop taking this medicine. What will happen is rebound angina. That is, again the person can develop, or again the person may have chances of angina. So never a medicine should be stopped. Take as it has been said to you. If it is said to you that you have to take lifelong, then please take it. So only one tablet, na? Because you know hypertension, just an example, I'm just telling you, hypertension is called as a silent killer. Okay, silent killer, people don't know they are suffering with hypertension. And when they are taking medicine, first of all, there is no much clinical manifestation also of hypertension. That's why people are not aware. And people feel I am all healthy. They have to, one tablet you have to take lifelong, then please take it, because that will help your other organs to be safe enough, as there are many complications of hypertension. Okay, anyways, so here you have to guide your patient not to stop it abruptly. Okay, side effects: hypotension, bradycardia and bronchial spasm can be there, but we have to be very careful about hypertension, because these medicines are given for hypertensive patients. So that when hypertension, ideally what it does is again vasodilation is causing and helping to maintain the pressure in a normal rate. So person can go in hypotension. So we have to be very careful, monitor the blood pressures of the patient. Next is calcium channel blockers. Now you can see calcium channel blockers always end with dipin. Okay, nifedipine, nicardipine, amlodipine, common. Calcium channel blockers are also called as CCB. Beta blockers are called as BB. Okay, dilates the artery, increases oxygen supply to the myocardium, decrease heart rate and myocardial contractility, okay, decreases oxygen consumption. So here very important thing what it is doing is dilating the arteries, so it will be very helpful for restoring the blood supply to the myocardium. Side effects again hypertension, bradycardia and edema, very rarely, but hypertension you have to be very careful of. Next is opioid analgesic, commonly given. You have to give the person some analgesic, in a simple word we say painkillers, right? So opioid analgesic, morphine is commonly used. When this is given, you have to see the person. Most common side effect of morphine is respiratory depression, so you have to be very careful when you are giving this medicine. Next is antiplatelet medication, that is aspirin, okay, prevents platelet aggregation on atheroma or thrombus. Now you remember when I told you in the etiology that when that plaque ruptures and it comes in contact with the blood, what is aggregating, what is forming on that particular plaque is platelets are going and forming a layer on it and then developing a clot. So when I give an aspirin to the person, platelet aggregation is not going to happen, so there won't be any clot formation. That's why aspirin is given to the patient. Side effects are GI irritation, bleeding chance. Now you can understand why there is chance of bleeding, because there is no platelet aggregation. You are literally making the blood thin. You are thinning the blood and there won't be any clot formation. Bleeding chances increases in the person, so they have to be very careful. Okay. Next is the oxygen therapy, administered usually 2 liters per minute with nasal cannula. You can also increase according to the demand of the patient and as it's been prescribed by the physician. Increase amount of oxygen delivery to the myocardium. Why we are giving oxygen? So that more amount of oxygen can be delivered to the myocardium. Okay, so this is about the medical management. Let us understand, we have also seen surgical also, that is CABG can be done. Let us understand the nursing management. So in nursing assessment, what you need to do is you need to assess for the clinical manifestation in the patient. Okay, you need to ask the exact location, how it is radiating, how it is subsiding, how it is aggravating, all these things in detail in order to identify whether it is angina or there are some other problems. Okay, so in detail, pain has to be assessed on the parameter of what we studied in the clinical manifestation. Next is the diagnosis. So what are the different diagnoses? Ineffective myocardial tissue perfusion related to coronary artery occlusion, and CAD is nothing but coronary artery disease. As evidenced by chest pain, anxiety. You know, when the person has such pain and he literally feels that he's going to die, so he becomes worried. He feels like he's going to die. That's why the fear of death is going to make him more anxious, and anxiety is further going to increase the myocardial demand. So you need to make him relax, tell him to rest, tell him to take the whatever medicines are given. You need to explain him to reduce his anxiety, because if he becomes more anxious, it will increase the workload of the heart. Okay, so anxiety related to fear of death. Deficient knowledge, because he must not be having knowledge that how he should maintain a healthy lifestyle. Okay, so and mainly he doesn't know about the disease condition. Deficient knowledge related to underlying disease and method for avoiding complications. Non-compliance, ineffective management of therapeutic regimen as evidence of failure to accept necessary lifestyle changes. Now, as I said you that this particular angina happens mainly because of atherosclerosis, that is fat deposition in our, that's plaque formation in our coronary arteries. And why this is forming? Because the person is eating more amount of fatty food stuff. And it's not only because of that, even stress also can cause increase in atherosclerosis. It's been researched and said. So it's very important that he has to make some changes in this lifestyle. Ideally, health is wealth, right? So you have to give them health education in such a way that you have to bring about a change. Now, whenever you're giving health education, see to it that you should not tell them this has to be done. Tell them to start slowly, because a person who is not at all walking now, and if you tell har din aapko you have to walk for 1 hour, so that's not possible. Tell him to slowly increase the schedule. That is, first, once you have not walked, so at least walk for 15 minutes, 10 minutes, and then slowly. because a sudden change is not acceptable and then the person will not follow it. That's why I said non-compliance means people are not able to adhere to the treatment what is given and make changes in their lifestyle. Change is always difficult for people, so always give them a health education to start slowly and then further increase it, so that they will cope up with it and try to adapt the change. Okay, so let us understand now here how we are going to the intervention, how we are going to reduce the pain and help him in the self-care. Okay, the two interventions we are going to discuss in detail. The first one is to restore the coronary blood flow and reduce the pain. What we need to do is assess. As you know, for every intervention we first assess. So assess for the characteristic of angina, that is onset, location, radiation, duration, sensation and severity. Administer, this is what we are going to give: sublingual, below the tongue, nitroglycerin tablet or spray as prescribed, because nitroglycerin dilates the coronary arteries, reduces the pain and restores the blood flow. We have seen in the medical management. Monitor, this is very important. Monitor the blood pressure if the patient is on nitroglycerin. Why? Because it causes vasodilation, the person will go in hypotension. That's why we have to monitor the blood pressure. Next is administer oxygen. Again, it will help to give oxygen to your myocardial cells. Administer antiplatelet medication so that there are no further aggregation of platelet aggregation is not there. Administer analgesic to reduce the pain for the patient, and notify physician if the pain is not relieved after 3 nitroglycerin tablets, each taken at 5 minutes apart or after morphine administration. What we are saying is that even if you have given the nitroglycerin sublingual tablets, as I said you, at every 5 minutes interval, and morphine also is given, the pain is not reduced, that means again is a medical emergency, unstable angina, and has to be treated further with some PCI or coronary artery bypass graft. Now, next intervention is prevent further attack through self-care. Okay, so what all thing you need to tell the person? Educate the client to avoid activities or habits that precipitate angina. We have seen the precipitating, what are the factors? So, avoid it as much as possible, that is eating large meals, drinking coffee, smoking, exercising strenuously, very hard, at least walk, don't do too much of strenuous where he is not able to cope up with it. Going out in cold weathers, being exposed to stress should be totally avoided so that further problem doesn't happen, because stress can precipitate your pain. Now this has to be educated. 3 nitroglycerin tablet has to be taken at 5 minutes apart. You need to educate your patient about. If the pain does not subside, then you should call for emergency. Explain importance of daily management of hypertension. Advise the client to take daily medication even if no clinical manifestation evidence. This is the commonest problem. People avoid taking tablets. BP has to be maintained properly, because in hypertension what happens, your vessels are mostly constricted and we have to give an antihypertensive tablets to make that vessels vasodilated and also to reduce the blood pressure. Okay. Encourage and help a regular program. Day exercises must for even normal person, right? Exercise has to be done. At least walking has to be done by the person to promote improved coronary circulation and weight management. So he has to bring his weight in normal BMI. Okay, that you have to guide him if he is obese enough. Next is instruct client who smoke. This is very important. Quit. Totally stop smoking. Why? Smoking cigarette raises carboxyhemoglobin levels in the blood, which reduces the amount of oxygen available to the myocardium. What it increases? Carboxyhemoglobin levels. So there is less amount of oxygen reaching to your myocardium. Advise client even to avoid passive smoking. Now, if a person is smoking, he is called as an active smoker. But if he has someone sitting next to him, like for example, commonly if a father is smoking and a child is next to him every time, then the child will be called as a passive smoker, because he is next to his father every time and he is also inhaling. So passive smoking also should be avoided. Active, so completely quit smoking, right? Advise client who are anxious, stressful, to take relaxation. Some classes or relaxation technique has to be utilized to reduce stress in their life. Okay, so consider relaxation technique and counseling if required. If they are not able to cope up with their life or some stressful situation, tell them to undergo some counseling so that the stress when reduced, everything will come down, everything will be normal. Encourage and help a regular program daily exercise to promote improved condition. We have already talked about this. Hope so you understood what is angina pectoris and what it is. It's nothing but a clinical syndrome characterized by where you are having paroxysmal or you are having an episodes of chest pain, anterior chest the pain is there, and mainly because there is lack of blood supply to your myocardium. Okay, thank you.